I want to speak more about the prisoners, HIV among prisoners in Iran, because prisoners is one of the high-risk groups in Iran because of the situation, and also a huge group of prisoners are injecting drug users, so it makes a prison very high-risk venue. The HIV Hub, that is a collaborating knowledge hub with WHO in MENA region, do some surveillance surveys among high-risk groups such as prisoners in Iran. We do the BBSS, biobehavioral surveillance surveys, among prisoners every 2 to 3 years. The first round of these national BBSS in prisoners was in 2009, and the second round was in 2012. We will have the third round in 2015 or maybe 16. And the main result of the first round of these BBSS is published in this paper that you can see here, and I will explain a little more. In each round of the BBS among the prisoner, we recruit 5,500 prisoners from 27 prisons all around the country. And we use the face-to-face questionnaire-based interview to collect the behavioral data, and also using the DBS, right blind spots, to have the HIV status and also the ELISA test. As you can see here, these are the main results of these 2 rounds. Here you can see that the total HIV prevalence among prisoners in the first round was 2.1%, and fortunately, it decreases to 1.4% in the second round, that was in 2012. And the HIV prevalence in some different groups of prisoners, some same as, for example, the prisoner who ever injected drugs, was 8.1% in the first round and decreased to 5% in the second round, and also it was less than 1% in prisoners who not ever injected drugs. In people who ever had tattoo, prisoners ever had tattoo, it was 3.3 the prevalence of HIV and decreases to 2.2, and the HIV prevalence among MSM prisoners, you know that. Measuring the MSM is very hard in Iran because of the cultural problem and something like this, and we could not ask the people about the MSM activity in the first round, and we just measure indirectly. And the 2.5%, 5% of prisoners had ever had anal sex with another man. But in the second round, it increases to 12%. But the HIV prevalence among this group decreases from the 3.7% to 2.7%. It's very good, and it may be due to the harm reduction programs and also the education that prisoners will receive. And some important behaviors among the prisoners, for example, that are the UNAIDS indices. The condom used in the last intercourse was not measured in the first round, but it was almost 25% in the second round, and 15% of prisoners use condom in the last anal sex with the other men in the first round, and decreases, unfortunately, to almost 6%. And also the 9% of prisoners had tested for HIV in the last 12 months and know the result in the first round, and it increases to 11.5%. The result of this study you can find in the paper that I showed, and the second round is unpublished data yet. And beside these BSS among prisoners, our colleagues did HIV trend, estimated HIV trend among prisoners in 1990s to 2000, analysis of aggregated data from HIV Sentinel surveys. From the 1991, we had some Sentinel surveys in prisons in Iran, so we have some aggregated data. In this aggregated data, my colleagues had data of the more than 155,000 prisoners in 72 prisons all around the country, and the overall HIV prevalence was 2.8%. In 1998, the HIV prevalence increased to 4.5%, and after that became stable at a level of 2.8, and so you can see here in this figure that this is the trend of HIV prevalence among prisoners in different years, and also you can see in the dotted line the number of sentinel surveys that we had in each year. As you can see in the figure, in 1998 it is some increases in the prevalence of HIV, but after that it became more stable. And in 2000, the first triangular clinic was established inside the prison, and after in one prison in northwest of Iran, and after that in the other prison it was established. And in 2003, the harm reduction services such as a needle exchange program and methadone maintenance therapy became available to prisoners, and maybe these activities make the HIV prevalence more stable. And also it is a special distribution of HIV prevalence among prisoners. HIV prevalence varied in different prisons from 0% to more than 13%. As you can see here, in the prisons that are located in the provinces in west and south part of Iran, these prisons had a higher prevalence of HIV, range from more than 3% to 13%, but the prisons that are in the north of Iran has the lowest prevalence of HIV. Besides these studies, we are doing a systematic review among prisoners, not only about the HIV, but also about the HPV and HCV, hepatitis B and hepatitis C. We did the literature review among the international databases and regional and also the Iranian databases. The number of the record that we identified, it was more than 100 records, and after excluding the unrelated and unrelated documents, we included around 60 articles in the systematic review about the HIV, hepatitis B and hepatitis C among prisoners. As you can see here in this figure, the HIV prevalence among prisoners from 0% to 24%. The study that I spoke about, it means that the BSS result and also the trend among prisoners is included in this study too. And the hepatitis B prevalence among prisoners is very different, from 4% to 80% in different prisons. And you can see here that the total number is 32%. It's very small, but you can see the red line is 32% overall. The hepatitis B prevalence is between 1% to 15% in different prisons, but overall prevalence is around 5%, 5.2% among the prisoners. One challenge about the prisoners and also the other high-risk groups or key population is measuring the high-risk behaviors. So you know that most of the time we cannot measure by direct methods. In a study, we use the indirect methods such as crosswise, proxy respondent methods, and also network scale-up to measure the high-risk behavior data among prisoners, and we compare these different data and the results together. 265 prisoners from 3 different prisons in Iran recruited to the study, and a structured questionnaire via face-to-face interviews to collect the sexual and injection risky behaviors by using direct questioning and these 3 indirect questioning methods. as you, I don't know if you can see the result or not, it's so small, but we have the very different results in these methods. As you can see here, prisoners disclose more about their injecting risk behavior than their sexual risk behavior in prisons. And also they reported higher sexual risk behavior for their friends and underreported their own sexual risk behaviors. It means that when we ask the questionnaire about not their own behavior but about their friend's behavior, they report easily related to their own behavior. And this paper is under submission to the journal. And these are the results about some result about the HIV among the prisoners in Iran. So it's time for you to have any question, comment, or anything else.